Depression, anxiety, and ADD. Part 1, Effect of Other Disorders on Sleep. Depression, anxiety, and ADD can mask sleep disorders, or sleep disorders can look like these conditions. These disorders also have effects on sleep. It's like chicken meets the egg. The problem is that the conditions are associated and there's no ability to tell which causes the other. If you have poor sleep and it's causing symptoms of depression, or vice versa. Part 2, Depression. People with sleep disorders may be treated for depression. Depression also causes fatigue and excessive sleepiness. A sleep diary may be helpful in this situation, determining if you do have depression or if you are really suffering from a sleep disorder or lack of sleep. Excessive sleep is also bad for overall health. We need to look at the time spent in bed versus time spent sleeping, how much time a person is exercising, how much you're being exposed to sunlight or if there's a lack of sunlight, and medications that one is on and the side effects of those medications. When it is depression, treatments include medication, and as always, we recommend speaking to your doctor about the side effects of these medications. Another treatment is exercise. Even if you're doing seated exercises, something is better than nothing, just getting movement into your body. Different relaxation techniques. This can include prayer, meditation, deep breathing to help bring down your heart rate, calm your anxiety. Nutrition is a big one. Staying away from processed foods, carbohydrates, sugars, all of the foods that we talked about that damage the gut health. And also making sure that you are getting enough sunlight, especially first thing in the morning. It can be even better than grabbing a cup of coffee, just taking a step outside, sitting in the sun for 10-15 minutes helps to wake your body up and get you in a lighter mood. If this isn't possible, if you don't have access to sunlight where you live, if it's cloudy a lot, you may consider getting a sunlight simulator. Part 3, Anxiety. Occasional anxiety is an expected part of life. You might feel anxious when faced with a problem at work, before taking a test, or before making an important decision. But anxiety disorders involve more than temporary worry or fear. For a person with anxiety disorder, the anxiety does not go away and can get worse over time. The symptoms can interfere with daily activities such as job performance, schoolwork, and relationships. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, and various phobia-related disorders. People with generalized anxiety disorder display excessive anxiety or worry, most days for at least 6 months, about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. The fear and anxiety can cause significant problems in areas of their life, such as social interactions, school, and work. Generalized anxiety disorder symptoms can include feelings of restlessness, wound up or on edge, being easily fatigued, having difficulty concentrating, mind going blank, becoming irritable, having muscle tension, difficulty controlling feelings of worry, and having sleep problems such as difficulty falling or staying asleep, restlessness, or unsatisfying sleep. People with panic disorder have recurrent unexpected panic attacks. Panic attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes. Attacks can occur unexpectedly or can be brought on by trigger, such as feared object or situation. During a panic attack, people experience heart palpitations, a pounding heartbeat or an accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath, smothering or choking, feelings of impending doom, feelings of being out of control. People with panic disorder often worry about when the next attack will happen and actively try to prevent future attacks by avoiding places, situations, or behaviors they associate with panic attacks. Worry about panic attacks and the effort spent trying to avoid attacks cause significant problems in various areas of the person's life, including the development of agoraphobia. A phobia is an intense fear of or aversion to specific objects or situations. Although it can be realistic to be anxious in some circumstances, the fear with phobias feel is out of proportion to the actual danger caused by the situation or object. People with a phobia may have irrational or excessive worry about encountering the feared object or situation. They may take active steps to avoid the feared object or situation. They may experience immediate intense anxiety upon encountering the feared object or situation, or they may endure unavoidable objects and situations with intense anxiety. Some examples of specific phobias include the fear of flying, heights, specific animals such as spiders, dogs, or snakes are pretty common, receiving injections, giving blood, social anxiety, agoraphobia, separation, selective mutism, failure to speak. Many sleep disorders such as sleep apnea and restless leg syndrome can cause anxiety due to the distress of the condition. Anxiety can cause insomnia and insufficient sleep. Parasomnias can be caused by anxiety, and anxiety can cause parasomnias. Treating underlying conditions. Treat any underlying conditions. Consider asking your doctor for a home sleep study. You can practice guided meditations, counted breathing, progressive relaxation, diaphragmatic breathing, exercising, yoga. These are all excellent ways to help deal with these issues and symptoms. Also, again, sunlight. Can't stress the importance of sunlight enough, or a sunlight simulator. Part 4. ADD and ADHD. There are 3 subtypes of ADHD. Predominantly inattentive ADHD features forgetfulness, disorganization, and lack of focus. This was previously known as ADD. Then there's predominantly hyperactive impulsive ADHD, which involves restlessness and impulsive decisions, but not inattention. And lastly, combined ADHD features inattention, hyperactivity, and impulsivity. People with this form of ADHD, previously known as ADD, will not have signs of hyperactivity, but they may have the following symptoms: difficulty organizing tasks or activities, being easily distracted from the task at hand, regularly forgetting daily activities, regularly losing things that they need to complete tasks, avoiding, disliking, or postponing tasks that are not interesting, regularly losing focus on schoolwork, chores, or duties in the workplace, not following clear directions, seeming not to listen when being spoken to, regularly making careless mistakes, and trouble holding attention on tasks or social activities. Attention Deficit Hyperactivity Disorder, ADHD, is a chronic condition that affects millions of children and often continues into adulthood. ADHD includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and impulsive behavior. Children with ADHD also may struggle with low self-esteem, troubled relationships, and poor performance in school. Symptoms sometimes lessen with age. However, some people never completely outgrow the ADHD symptoms, but they can learn strategies to be successful. In children especially, ADD and the sleep deprivation have the same symptoms, which include restlessness, irritability, poor ability to concentrate, and fatigue. It is essential that people with ADD have a sleep study to help determine if there is an underlying sleep disorder. A sleep diary is also essential to determine what can be done to help with any sleep problems. And finally, medications for ADD can have significant effects on sleep. Recommendations for strong sleep routines include sleep hygiene with a strong sleep routine is essential, light therapy and decreased light exposure before bed, so turning down the lights while you're winding down, getting off of your phone and the TV, no exercise at least 2 to 3 hours prior to bedtime because that can be stimulating, avoiding caffeine, and finally, relaxation techniques that may help, but guided imagery or other sedentary practices may be difficult. You're now ready for the next module.